Hello viewers, welcome back to my channel Dr. Abhinav Kumar MD. I am Dr. Abhinav once again with a very special patient who has flew all the way from London to get his fifth, the most difficult and the final hair transplant done from us, and meet Mr. Neki, who has flew all the way from London to get his final and the most difficult transplant done at Patna. The patient from my previous ventures was involved in the surgery in his second and third hair transplant in 2018 and 2019. After that, he got another surgery done in 2022, and before coming to us for the first time in my previous venture, he was got another surgery done in 2015.
First one.
15. So 5 hair transplants in total.
10 years.
3 with us, 2 in my previous venture, and 1 finally at my own setup. And he trusted me for his most difficult, most challenging transplant, which involved not only his extraction from his already depleted donor, which has nothing to extract, and he wanted short trimmed hair at the back. After this, with the help of a scalp micropigmentation, we are also extracting from the beard, I think for the 4th time.
Yes.
4th time.
5th time.
And we extracted from the chest twice. So such a challenging case is hardly found. His story is well mentioned on Hair Restoration Network, and you can follow that. I will share the link. So welcome, sir. Welcome to Patna.
Hello, doctor.
And you came to me with lots of expectation and hopes of getting the final touch-up done. And this was not a touch-up. In fact, it was involved approximately 3,000 grafts, in which approximately we got around 14 to 1500 from the back of the scalp, approximately 500 to 600 from the beard area, and around 1200 from the chest. So such a big surgery, and that to the 5th surgery, and he's in front of you on day 3 of surgery.
That is.
So just tell about the overall experience and what are the challenges you think were there in this surgery.
Yeah, I'm not new to hair transplantation. I know the ins and outs, and I was coming compromised with the hopes of doing one final one and making it my final, finishing things off. And yeah, I couldn't choose a better doctor. I was in contact with a few other people.
So what are the challenges? We will go to there are many big surgeons, and we're trying to approach even the best ones.
Yes.
Right. So what are the challenges and why they refused?
You're going compromised. All the cherry-picked grafts have already disappeared. Have already been used up for previous transplantation. They know they're going to be, having weak, less pigmented, thin grafts that they're not confident to get good results because of their handling of or their actual skill with the procedure. So people will not.
Even the top surgeons, whose name I won't mention, refuse or diffuse to give any answer regarding his challenges, the challenges of the surgery.
I didn't get reply on few.
So he has to finally come back to me, and he approached me, and I took up the challenge and did his surgery in Patna. And it was a very challenging case. It took us like more than 26 hours and 2 hours of discussion before the surgery for doing just mere 3,000 grafts, which is usually completed in 12 hours.
Even less.
Even less in, you can say, most of the hair mill clinics.
Yeah, it was a difficult situation.
Yes.
And very limited potential of removing grafts, compromised already.
So you just educate our viewers. What are the challenges of getting a beard extracted for the 3rd or 4th time from the face?
Yeah.
From the face.
I mean, everything was a challenge. You already know this. Chest was a challenge. Beard was a challenge. The limited amount of grafts left over in my donor, challenge.
Yeah. So the risk is of getting a donor exposed first. So we have to extract uniformly in a way that even if he keeps the hair long, it's all okay. If he keeps the hair short, we had to discuss. It is not visible to that extent, or it can be hidden by scalp micropigmentation. We have not yet exhausted his donor. The hair still stays there.
Yes.
And I'm very hopeful that his results at the front and the mid scalp and the crown will be good. But even his donor would be, you can say,
uniform,
homogenized.
I insisted on basically touching on the parts which were not previously.
We corrected his bad temporal triangles, temporal points, We improved it. We matched the hair of the temporal area with the natural hair behind it. So it was very, very challenging. He has blonde hair, and the one needs to match the color of the hair nearby with the planted hair.
This one was a grayish. It was grayish. So we had to remove and then.
So we did not color his hair before extraction, so that we can cherry pick those hair and plant at sites which are cosmetically more important, and whose color matches with the natural hair there.
It's all visuals. It's right in front of you. You cannot have thick, pigmented temporal peaks and everything behind it just thinning and gray.
So you just describe your experience in few words about the overall surgery and the things which have happened here. People even don't think of coming here into Patna from London, but you did that.
It's around the world this far. It's a journey. It's a journey.
It's a journey. You traveled here. You have been to India 4 times.
I've been before. Yes.
Yes. And this is your 5th visit.
The 5th.
And you're not disappointed in any of your surgeries in the past. Right.
Maybe things could have been better, a bit better. The planning could have been better. So lack of communication wasn't there from previous surgeries where I was basically in a constant.
It's easy to grow hair, but it's not so easy to do as per patient's plan and requests. It is also easy to do a natural hairline, but it is very difficult to create a hairline which patient wants. It's easy to, you can say, pull out grafts from everyone, but it is very difficult to manage the aesthetics of the area from where you have pulled out those grafts. And that's why we took approximately 2x the time of the conventional time which we should have taken to do the surgery. I am really grateful that he is giving a video, and he's giving a video for the first time in his life.
His
first photograph, his earlier photographs were hidden.
Yes.
And he was not willing to share those photographs.
A young, immature now, a bit grown up. I couldn't.
Now he's married, and he wants to go to phase 2 of his life, and he's giving a final video, you can say, to us. I'm really humbled, and I know it will help me in my career, but I also know that the content of this video is priceless for people who are looking for such, you can say, even repair surgeries. Who are looking for repair surgeries. Is anyone capable of doing a repair surgery? Is anyone understands the color of the hair? Is anyone understands the aesthetics of chest grafts? Where to put, where not to put?
Yes.
Is any doctor in the world is willing to sit with the patient for 2-3 hours and decide how we can reach to what we want, or we can reach to a middle point?
Yes.
These things are becoming very, very rare in an industry where I think not less than 8 to 10 surgeries are performed in one clinic per day all over the world. And those clinics who are not performing, who are doing exclusive surgeries, are doing it at such a price that most of even Europeans cannot afford. At this point, they have to do a lot of saving for like 1 to 2 years to afford those surgeons who can do that level of work. So we are trying to create a middle path. I'm in a smaller place, but you can approach me. I'm affordable.
Yes.
And you just need to add your flight tickets. Yes. And rest of the things are within your budget. So overall experience,
we're finished very happy. Couldn't have been smoother. Happy from literally landing here to tomorrow.
You liked the food again? You had a lot of biryani?
Of course. Very enjoyable experience. Apart from the anesthesia, of course. Donna was scarred from previous transplants, meaning the pain threshold was going to be.
And the skin was hard. This is hard. That's already the recipient side was scarred and very challenging. And I must thank my assistants as well, not only the doctor. It is the skill of the assistants. We cannot do this surgery without these assistants who are extremely skilled.
Yes.
And their support and their perseverance and their stamina to withstand such requests and to extend the surgery for such a long period of time before getting frustrated. So we must also thank them, and I'm extremely grateful to the patient, Mr. Neki, as well as my assistants.
Thank you, sir. No, thank you. Appreciate it. Thank you.